Thank you for joining Facebook Live session of World Parkinson's Program. Today is April 8th. Welcome to Toronto. We will be having interactive session on questions and answers about Parkinson's disease. Please feel free to ask any questions. Due to some technical difficulties, we had to access internet at our place, so we were a bit late. We apologize for this. So we like people to join us, ask questions, and make it more interactive rather than a lecture or so. So please also ask your friends and colleagues, forward the link to them so that people can ask us more questions. This is educational session for information sharing of knowledge. As I say always, those who fight Parkinson's with knowledge always find solutions. So we would like to share with other people things which we have learned with our experience. So also when you join us, please let us know where are you from so that we know where our program is being watched. So as I said before, this is more interactive and an informal discussion. This is only for sharing information, and the treatment of individual people is up to their own physicians. We have website www.pdprogram.org. For now, we are doing these sessions on on Saturdays, 3 p.m. Eastern Standard Time. And depending upon feedback of people, if people join us more and more with time and they find this time suitable and find these sessions to be useful, we may continue these. Otherwise, we may have no choice except to stop doing them. So please give your feedback as well. We have a question. What is bradykinesia? So the first question is, what is bradykinesia? Bradykinesia is a medical term which is used to refer to slowness of movements. The slowness of movements is one of the main symptoms of Parkinson's disease, and most patients would realize that they take longer time to complete their daily activities as compared to before. Their families might notice this. However, this term sometimes could be referred as akinesia. Akinesia would be complete lack of movement. Bradykinesia would be slowness of movement. I think the bradykinesia is more proper than using the term akinesia. However, akinesia has been used in the medical literature for a long time as well. So bradykinesia could be a presenting complaint to the physicians, although patients would not come and say that they have bradykinesia. They would describe various symptoms or various things which could be a manifestation of bradykinesia. Please tell us where are you joining us when you ask a question, so that we have some idea. So another question is what causes rigidity, or I can't see the screen, it went off. So maybe I turn this way, maybe better. What causes rigidity in Parkinson's? Yes, rigidity is a term which is used for stiffness. Stiffness is used by people, but rigidity is more a medical term. Rigidity is a ratchet-like phenomenon which is felt by the physician when they are testing patients' stiffness. It could be tested in in arms and legs as well as in neck. So limb rigidity, when is being tested, the physician would feel that throughout the range of motion there is a stiffness or there is a sort of resistance when they are doing this. However, in the beginning it could be very subtle and it could be asymmetrical. It could be more prominent on one side of the body as compared to both sides, and as the disease progresses, the stiffness may become more prominent, and it may become obvious on both sides of body. And this stiffness causes this stiffness is likely a muscular phenomenon, and in patients with idiopathic Parkinson disease, which is the most common type of Parkinson disease, the stiffness or rigidity is more prominent in the upper limbs as compared to neck. And in patients who have atypical Parkinsonism, in those patients it could be more prominent in neck as compared to the upper limbs. Most patients may not be familiar with rigidity, especially in the beginning of the disease. It is more of a sign of Parkinson's disease rather than a symptom, especially in the beginning of the course of the Parkinson's disease. We have another question, how to treat bradykinesia. So we would speak a little bit more about bradykinesia. Bradykinesia, or slowness of movements, as we were discussing, may take various forms. Overall, it's a slowness of movements. However, when it's being tested, the patients may have many different manifestations of bradykinesia, such as decreased eye blinking. It's also a manifestation of bradykinesia. There's a slowness, so the rate of eye blinking is less. Similarly, when patients are asked to do finger tapping, or opening and closing of their hands, or hand turning, so they may have overall slowness of movement, or they may start with a good speed and then their speed drops as the time goes, and also the rhythm of the movement may become less and less, and it may in some cases become irregular, and patients may break down the rhythm of the movement when they are doing these things, such as heel tapping or toe tapping on the floor. And also otherwise in general life, patients when they're walking, their speed of walking decreases, and sometimes when they are walking, they are noted by the family members that they are not swinging one arm, or whole one side of body is lagging behind the other side. So these are different manifestations of bradykinesia. Similarly, if you ask patients to do shoulder shrugging, you will see that the affected side shoulder does not do the shrugging as faster as the other side of the body. So the slowness of movement, or bradykinesia, is the most important and the most cardinal symptom of Parkinson's disease, and the typical medications used for Parkinson's disease, such as levodopa or dopamine agonist, they help to improve the bradykinesia or slowness of movements. The slowness of movements is most disabling, and the most of the decisions of treatment could be made looking at the slowness of movements, because it's one of the limiting symptom of Parkinson's disease, that patients cannot do things such as patients have difficulty writing. they may have change in their handwriting. The handwriting becomes slow, and similarly, these patients may have trouble brushing their teeth due to slowness of movements. They may have difficulty combing their hair. At the same time, they take longer time to cut foods as well as handle utensils, dressing, putting shoes or socks or tying shoelaces, and also combing and grooming takes longer time. Putting on their clothes take longer time, and overall changing the side in bed may become slow. These are all different manifestations of bradykinesia or slowness of movements. So bradykinesia or slowness of movement is treated by medications. The main medication or most commonly used medication is levodopa. However, the decision to use different medications is dependent upon the age of the patient, the stage of the disease, as well as the other symptoms, such as if patients have more dominant tremor or if they have more dominant stiffness and slowness. So individual decisions are made according to the condition of every patient. So bradykinesia, as I said, is treated by the medications. However, other things such as exercise also help to improve these symptoms. What are some practical tips you would give for patients dealing with daily symptoms of Parkinson's? How can they improve their lives? This is a very open-ended question. There are a wide array of symptoms of Parkinson's disease, starting from any system of bodies, or starting from, in general, slowness of movements and tremor and rigidity and balance problems, and then Parkinson's disease. It's one of the most complicated neurological disease. It affects almost every system of body. It causes psychological problems or emotional symptoms. It causes urinary symptoms. It causes sexual dysfunction. Parkinson's causes autonomic problems. It does cause speech and swallowing problems. It causes constipation, drooling, other gastrointestinal issues, and also the problem with the sensations, like feeling of sensation, loss of sense of smell, excessive cold sensitivity. Parkinson does affect skin. So it causes so many wide symptoms that it's difficult to cover in one session the practical tips which can help. So these are based on individual symptoms. We take every patient as a person, and we look at their symptom, that at what stage they are, at what stage at what stage they are, and what type of different symptoms they have, so that we can focus the practical tips to that problem. For example, if patients have if patients have constipation, then we talk to patients how often they have bowel movement. Do they have to really push hard, and what type of constipation they have? Is it obstructive type of constipation, which is, according to most experts, most common type of constipation is the outlet obstruction in Parkinson's disease. So patients build up their stools, and they may have then after a few days they may have explosive bowel movement. So then we advise patients to exercise, first of all, to change their diet, add more fiber, more fluids, and add bulk farming diets, which does help constipation, more green and leafy vegetables, which could help, as well as use of fruits. And if these strategies do not help, then we ask patients to add things such as Metamucil, and sometimes prune juice may help. Hot and warm liquids, especially taken in the morning, help as well. If these strategies don't help, then patients can combine various strategies. They can move on to medications such as stool softeners or Senokot, or other medications which are used for this purposes. So there are a lot of strategies which may help individual complaints or individual symptoms of patients. We have another question about the prognosis of Parkinson's disease. The prognosis of Parkinson's disease is also an open-ended question. However, we can briefly say that patients who have a tremor-dominant Parkinson's, I think we discussed this in our previous sessions, patients who have more obvious tremor than stiffness and slowness, so that most experts refer as tremor-dominant Parkinson's disease, whereas those patients who don't have a tremor, they have more slowness and stiffness. That is usually called akinetic rigid type of Parkinsonism or Parkinson's disease. So the tremor-dominant Parkinson's disease overall has a better prognosis. These patients can fight this disease for a longer period. It does respond to medications better than akinetic rigid, and other symptoms such as dementia or hallucinations or psychiatric symptoms are less in tremor-dominant Parkinson's disease as compared to the symptoms of psychological issues, and those as compared to in patients with akinetic rigid variant. So overall, you could say that the prognosis is better in patients with tremor-dominant Parkinson's disease as compared to akinetic rigid type of Parkinson's disease. Another request we have: could you shed some light on some of the early warning indicators of Parkinson's disease? Again, the symptoms of Parkinson's disease are so diverse and they are so wide that it becomes really difficult to develop a set of symptoms. Therefore, this is one of the reasons that the diagnosis of Parkinson's disease is not based on the non-motor symptoms, because non-motor symptoms, again, they are non-specific to the Parkinson's disease, and they could be seen in some other neurodegenerative diseases. Some of the early signs are usually with respect to non-motor symptoms. Loss of sense of smell could start many years before the symptoms of Parkinson's disease. Similarly, lightheadedness or dizziness and symptoms such as anxiety or depression could start before. So these symptoms, lack of arm swing, sometimes is seen many years before the diagnosis of Parkinson's disease. So sometimes the non-motor symptoms may start many years before the onset of Parkinson's disease. Another of these symptoms is REM behavioral disorder, but the diagnosis of Parkinson's disease does rest on the motor symptoms, which are slowness of movements or bradykinesia, tremor, as well as rigidity. Usually balance problems come later. So the diagnosis is dependent upon the motor symptoms. However, the non-motor symptoms may start much before the motor symptoms of Parkinson's disease in various patients. However, based on non-motor symptoms, we cannot conclude the diagnosis of Parkinson's disease unless patients have motor symptoms of Parkinson's disease. Please forward the link of Facebook live sessions to your friends and people you know. So we do these sessions every Saturday, 3 p.m. Eastern Standard Time. So please share this with other people. You can also visit the website www.pdprogram.org. That website has a lot of information in various languages. I believe there are brochures in 15 to 20 languages which are uploaded. People can also write to the organization World Parkinson's Program to get more information. They can get hard copy. They can get hard copy brochures by writing. Also, patients who cannot afford medications or patients who cannot afford walking aids, they can also write to this organization, and after due diligence, they can also fulfill these requests. So please feel free to contact them. Thank you very much for joining us. We would be seeing you next week, hopefully, Saturday. That would be April 15, Saturday, 3 p.m. Please join us. Please forward this link to others, and please do provide feedback. We will do these sessions for about 3 months. We started in March, and then we will assess if people find this beneficial and join us and they ask questions, and we keep it interactive and they provide us feedback. We may continue them. Thank you, and have a good weekend.